Okay, let me explain some of the important things about radiation. You want to try to eliminate your contact with it as much as possible. It's dangerous. If you get too much radiation, it's bad for your cells, your DNA, everything. Pregnant people probably should not be using the X-ray at all because the fetus is more susceptible to damage because it's growing at such a rapid pace. We have a badge that we wear, the dosimetry badge. Should be worn at all times on the outside of your gown so that it can record how much radiation you're getting and let you know if you're getting too much. We have here at the clinic, we have lead gowns, we have the lead thyroid protection, and we have lead gloves. Unfortunately, we only have one pair of gloves right now, so sometimes we have to share. We try not to get any part of ourselves in the main beam, if at all possible not to. Occasionally, animals don't want to go along with this, so we have to do what we have to do. Restraint methods, we try to use the least amount necessary, but I do like some chemical restraint. There's nothing like an anesthetized animal to be able to get that shot quick, accurate, and you should probably not have, you should have as few people in the room as possible to limit their exposure. And you only want to, you're aiming for one shot to get what you need. You don't want to try to expose them to as much or as little radiation as possible. Hello, I am Sarah Malone, student number 2176157, and this is the radiology course. This is our radiology room. This is our radiology equipment. Here's where we set centimeters equals distance. Our KP is for a kilovolts peak, and the MAS means the milliamps per second. These adjustments are going to give you your contrast, clarity of your X-ray. This is our it's hard for me to say, columnator. There we go. And this is going to adjust our beam so that you don't want it too large, that way you get scatter radiation. Nobody likes that. And this is the lamp that puts the crosshairs down on our patients so we'll know where to position them to get the X-ray. This is our safety equipment. We have gowns, we have the shield for our thyroid. These are our markers so we know if it's left or right. These are our lead-lined gloves. We don't have any sandbags, so when we use the gloves, most of the time our hands really aren't in it, and if they are, they're not all the way in it. We fill these up with normal saline bottles to weight them down for the patient. Over here we have a digital system where it goes in. You can see your patient, labels it with all the pertinent information, shows you your X-ray. We also have the ability to crop. Say if you just want to cut out parts, enlarge, we can import it, or we can export it actually, and turn it into a JPEG so that we can, maybe send it to, attach it to an email to another vet if they would like to see the X-rays, or we could even send it to the patient's owner if they want to look at it. This is the database, and these are all of the radiographs, date, time that we can that keeps our records of the patient and how many radiographs we took for them and what day. This also goes to the patient's file, and that's how we store it. That's it.
Lateral tibia fibula.
Lateral tib fib. So we're on our left side. trying to get this one. Whoops. I cannot hold on with the gloves. She's too little. Okay. Got that one.
You're gonna have to. You have to wear it. No, you have to. Your hands in this one.
No, you
They're gonna get onto you way more than they will me. Alicia just told them that we didn't have another set. So one hand is gonna have to pull her head back.
Mhm.
You're okay.
Good
Girl.
Okay, Tommy, film.
I'm ready.
Okay, now we're gonna do
Girl.
cranial collar. Radio.
Good girl.
Yay! Good girl. For hip dysplasia, we're going to pull a marker in there and pull them straight and rotate them in. Alright. Good girl! Next,
Okay. Lateral abdomen.
lateral abdomen. We're going to move her up so the crosshairs are centered on the abdomen. We don't want to have any legs. I'm going to stretch that out, mark her down for the right hand side, go. Okay?
Lateral elbow.
Lateral elbow. Move it down so that we can get the elbow. Put our marker down there. Whoops, lost our marker. Going to center the crosshairs on the elbow. There we go. Next,
Lateral radius ulna.
lateral radius
PD thorax.
ventrodorsal thorax. Doggy goes on the back. Centering the crosshairs on the chest. Try and get her no legs in the V, marker down right. And there we go. All right. We're going to do your teeth. We're going to rotate you just a little bit. Go. Okay, okay.
Perfect.
Here we are with our dental radiographs. We do not have a dental x-ray machine, but I think we got just about as good as you can get with a regular radiograph machine. This is Bella, and she's going to do a GI series today so we can check her intestines to see if they're moving correctly. We're going to give her a little barium. Oh, wait a minute. It's
Good girl.
good. Oh!
Good girl.
Okay. Yeah. We're going to give her a few minutes. And then we're going to take some x-rays to see where that goes. Done. And we're going to take an x-ray of her abdomen to see where that barium's gone. Good girl. Now we're going to repeat that every 15 minutes so we can see its progress going through her gut. Good girl. Thank you.